We Americans constitute only 4.6% of the world's population, yet we consume 2/3 of the entire world's illicit drugs, including 80% of the global opiate supply and 99% of the global hydrocodone supply. These numbers were rendered from the study National Survey on Drug Use and Health, published in 2008. To put it succinctly, we Americans love our drugs. So this brings to mind some interesting questions. How bad is Americans' lust for drugs? What drives us to consume these illegal drugs? And what can be done to alleviate this epidemic? Presently, there are 17 million marijuana users in America today, 7 million who misuse prescription drugs, 1.6 million cocaine abusers, and 600,000 methamphetamine users. While usage numbers for methamphetamine and cocaine have held steady over the recent years, opiate and legal use of prescription drugs have tripled in the last decade. Since 1980, the number of deaths related to drug overdoses has risen over 540%. These statistics were all taken from the National Survey on Drug Use and Health 2010, done by the Substance Abuse and Mental Health Services Administration. More individuals are seeking treatment for addiction at unprecedented rates. In 2010, an estimated 23.2 million people aged 12 or older needed treatment for a substance abuse in the United States. Though only 2.6 million people actually actively took part in the treatment program, according to a national study on drug use and health conducted by the U.S. Department of Health and Human Services. That number is up from 1.8 million in 2007. So it's apparent drug use in this country is high, but what drives individuals to consume? Well, simply put, drugs make you feel good. We Americans live in a society that can stray into hedonistic territory at times. Pleasure and instant gratification are what many of us desire and feel entitled to, and that's something drugs can provide a user. Why work for the pursuit of happiness when it's just a pill, a puff, or a pull away from instant ecstasy? Drugs can offer an escape from the daily troubles of life. And with continued drug use, users inevitably become physically and mentally addicted to the drug's effects. From there, they descend into a downward spiral that many cannot escape from. In the case of opiate users, longtime addicts literally cannot live without the drug, their body becoming so dependent on it that they would die if they abstained from using. James Garbutt, a professor of psychiatry at the University of North Carolina, states, at 1 year after stopping opiates, there is an 85 to 90% chance of relapse. Cocaine addicts have a relapse rate of 55%, crack at 88%. We know some of the causes that drives individuals to consume illicit drugs. Now we need to figure out how to curb illicit drug use. Hoping to stop all illegal drug use is an impossibility. It's also impossible to gauge what would be the best way to reduce usage. One potential solution that is slightly radical but has been proven a success in reducing the number of people consuming illegal drugs is decriminalization. In the country of Portugal, they decided to decriminalize all drug offenses back in 2001. Rather than arrest and incarcerate drug users, they focused on treating them for their addictions, a more cost-effective and more humane methodology. And according to the president of Institute of Drugs and Drugs Addiction, the number of individuals addicted to hard drugs has dropped in half over the last 20 years. In a similar vein, some experts believe we should change the way we spend money on fighting the war on drugs here in America and how we handle drug users. According to Joseph Califano, director of the National Center of Addiction and Substance Abuse at Columbia University, America is spending too much money on incarcerating drug users and enforcing laws, and not enough on treatment to addicts. 65% of inmates in jail are there because of drug-related crimes, and only 1 out of 10 is receiving proper treatment for their addictions. And Josette Bickel, an inmate who was on trial in 2011 for trafficking heroin while in prison, said to the jury at her trial, "It's easier to get heroin in prison than outside." Addicts in jail not receiving treatment while having ample access to drugs is not going to help them break the vicious cycle of self-destruction they are in. So it should be clear to you now that we do have a drug epidemic on our hands here in the United States of America. There's no easy explanation as to why we are this way, nor is there any easy solution. But at present, more and more individuals are becoming addicted, despite the conservatively estimated $40 billion we spent so far this year alone fighting the war on drugs. Something needs to change. One thing is for sure, Statistics, studies, and scholars say we should stop demonizing addicts in society. Instead, we should understand they are suffering from an illness, one they cannot control on their own without help. We should have an open dialogue about drug use in America and try to figure out how to help those afflicted with addiction. Until we do, these upward trends in illicit drug use will most likely continue. Thank you. Yay, America.
Now, sit there, light up a joint.
Whoopsies!
You're 5 minutes within time limit.
5 minutes within the time limit?